public meeting. And you can just hear it recorded, it is in public, and this meeting will end up on YouTube for people who want to revisit and have a look at the procedures. Okay, so I'm going to sort of share with Kate, you know, so it's a double duo here. And I'm going to hand over to Kate at this stage to take us through the report.
Okay, this is just going to be a whistle-stop tour of what we've done during 2021 and then what we're planning to do for 22-23, and a little bit about what it is that we're actually doing at the moment. So thank you, Marcia. Marcia became our chair back in August, and we're really, really pleased to have Marcia with us. This is the agenda. So Marcia's already done the welcome and introduced the advisory board and some of the staff. We'll just touch on some of last year's key challenges and looking back at 21-22 in more detail, a little bit about our budgets, then our plans for 22-23, and then any questions. We have already had some written questions submitted.
And I also forgot to give apologies for Natasha.
Yes, one of our
member of staff.
Okay, so as with all organisations throughout the country, we were affected by the pandemic. It did affect some of the work that we could do. So we weren't able to do some of the interim view that we did. The previous year we'd won awards for the work that Sheila and Wendy had done at Kettering General. We had to, for obvious reasons, curtail a lot of that work. It was also the end of the previous Healthwatch Northamptonshire contract, so that ended in June 2021. There was a lot of work that went into going for the new bid, for the new tender. We were really fortunate that we were re-awarded the contract from October, and it's a 2-year contract to October 2023. Unfortunately, it is a static budget of 195,000 per year. This, in effect, really is a decrease, a year-on-year decrease as costs go up, wages go up. So we do have to make it go a lot further each and every year, which is no small task. New advisory board was started up in October, and to date we have a very active Healthwatch advisory board, and it's now reached its maximum of 10 volunteers, led by Marcia as the interim chair with Will as the vice chair. One of the things we hadn't planned on and which was news to all of us, including the commissioners, was that with guidance from Healthwatch England, that because the county council no longer existed, we would have to have a complete rebrand, and that we were in effect representing two Healthwatch. So they were Healthwatch North Northamptonshire and Healthwatch West Northamptonshire. And you can see with our logo at the top, Healthwatch England helped us to redesign it because it was a bit long. We've managed to keep just Healthwatch and then North Northamptonshire and West Northamptonshire under it. We have been allowed to keep the website address, which is www.healthwatchnorthamptonshire.co.uk, as that covers the whole, as we do cover the whole of Northamptonshire. The other challenge was that we had some staff changes that year. Esther's already been introduced, but Esther was our lead officer for projects, children, young people and families, and Young Healthwatch Northamptonshire. So Esther, we were very sad to say goodbye to her, but she's gone on to do a degree, a law degree, I believe, Esther, at the university. So we're on to bigger and better things. Lauren, who had started off as an apprentice and stayed with us for a year after she completed her apprenticeship, then for someone that was not academic at all, then went off to Leeds University to do a media degree. And Dr. Jo Spenceley, she went to the public health team in Northamptonshire. So we still have a relationship with Jo, but we don't have her expertise within the team. But, you know, our loss is Northamptonshire's gain. Quick look back at 21-22. So this is just a little bit of our year in numbers. If you want more information, it is all in our annual report, which is on the website, which was published 30th of June. So overall, we engaged with 707 people that shared their experiences about health and social care services. There were 12,941 visits, which is quite a lot, to our social media pages, including Young Healthwatch. We gave out lots of advice and information. We share a lot of Northamptonshire healthcare partnerships, key messages to keep the public informed. We published 4 in-depth reports ourselves with recommendations and suggestions for service improvement, particularly our carers report. That was our most popular project, and I will tell you a little bit more about that later. We were lucky enough to have 39 volunteers that gave up their time to improve care for Northamptonshire residents. And we worked out that it was probably, give or take, I'm sure there was more hours actually that we haven't accounted for. So this is a minimum of 1,345 hours that they spent volunteering, which we could not have done the work without them. Our volunteers do several roles within Healthwatch. So they make up our advisory board, which is led, as we said earlier, by Marcia. So they look at our strategic direction and are on our high-level partners boards, for example, the health and wellbeing boards. There is also the planning group, which helped develop that strategy to deliver the work plan. They help set the work plan by looking at partners, priorities at the beginning of the year. They will start doing that at the end of this financial year to lead the priorities for next year. They also sit on task and finish groups. So where we have a project, we put together a project plan, and the task and finish groups lead on that project from beginning to end. So that's right from what is it that we need to do. So for example, this year we did the GP access survey. What does that mean? Who will we need to target? What are the questions? What do we hope to get out of this? Who else, what other partners can we involve in this? Right through to the end, where we have a report and we make recommendations to our partners and providers and commissioners on what we've found. It won't be ever a Healthwatch North and West Northamptonshire view. It will be a public view. It will be what the public have told us in Healthwatch. They also ensure that we deliver our statutory role and functions. So for example, you met Carol earlier. She is now our lead coordinator for signposting and feedback. So we get a lot of calls and emails from the public on a daily basis. We have just estimated that each contact for us takes at least 40 minutes of our time. Sometimes we can be on the phone a lot longer, particularly if people are upset or concerned. And this doesn't even take into time where we put the information on our Civi system that we can feed back to commissioners, providers, the CQC and Healthwatch England. We also use the volunteers' experience and expertise for them attending various boards and committees. As I mentioned earlier, there's the health and wellbeing boards. We now have the place delivery boards. There's the Community Diagnostic Centre board. There's the Mental Health and Learning Disability and Autism board. There are so many boards that our volunteers get involved with to represent not only Healthwatch, but the public. As I mentioned earlier, with our reports and that, we proactively gather, listen and represent the views and experiences of local people. It isn't a Healthwatch view, it is the public view. And that is our whole purpose of being in the privileged role that we have. We try to ensure the voice of local people is championed at every opportunity. So how we've made a difference. I mentioned the 4 reports that we did that year. We teamed up with Northamptonshire Carers and Carers Voice to find out more about carers' experiences during the pandemic. And there's a little bit more information about that on a later slide, but you will find the report and all the recommendations on the website. Some of the feedback that we received from that, I will go into who responded to that as well in a little while. Young Healthwatch, they looked into young people's mental health and wellbeing and developed a staff training programme. So Esther successfully produced some training videos which they use for training staff on the transition between young people's mental health service as they transition into adults services. We teamed up with Northamptonshire Clinical Commissioning Group, as it was then, to gather feedback on the NHS First 111 system. I'll say more about that. We attended the local dental meetings with updates from NHS England, so we could share that information with the public, and we shared information with different communities to better understand the COVID-19 vaccination programme. And we are still working with the NHCP to get that information out about the current booster programme. So a little bit more information about the making NHS First 111 more accessible. We were asked to do this by the CCG, so we worked there with them in designing the survey and how we targeted people. We particularly wanted to hear from those with a hearing loss, impaired vision or other accessibility challenges. So we also went to Deaf Connect to help us get more responses there. Some of the main feedback was the difficulty understanding the automated menu, the link to interpreters, British Sign Language and easy read on the online version wasn't easy. We made 4 recommendations to improve that service. And again, there's the link to our website where you can find the report in more detail. Oh, have I got 2 slides? There we are. That's it, isn't it? The biggest report was the one that I mentioned earlier, where we teamed up with Northamptonshire Carers and Carers Voice. And it was important that we worked with our partners to get to as many carers as possible. They told us a lot about the physical, mental and emotional well-being that they suffered during lockdown and how it was affecting them. And I think this one quote from a carer that we included in the report was their thanks that we did the research, that they felt that no one had really asked them how they had coped during that year caring for their parents, and how they had muddled along, and how they realised once they'd been asked the questions just how tough it had been. For this report, our recommendations went to all the main service providers and commissioners, and in the report you can find the responses from Northamptonshire Carers, from Public Health Northamptonshire, West Northamptonshire Council, Northamptonshire CCG on behalf of primary care and the Northamptonshire Health and Care Partnership, Northamptonshire Healthcare Foundation Trust, Kettering General Hospital and Northampton General Hospital. So you can see that was a really impactful report that we did there, even though it was in the middle of COVID. One of our statutory roles, functions, is to provide advice and information. I gave you the numbers there, but we also provide up-to-date information on COVID-19. We link people to reliable information that they can trust, and that's very important when there is a lot of information out there. We help people to access the services they need, to understand the complaints and the compliments process, which can be quite overwhelming at times. We helped a lot of the people understand why they couldn't get a dental appointment. We even run round every dentist there is in Northamptonshire to put together a list of people that may be taking people on, and we also provided information for where people can go for urgent dental care, which we are still doing today. The ongoing dental issues, we provide the information. The infographic there is a bit small, but we did provide as much information as we could to assist people. The public were frustrated, and they are still very frustrated about not being able to access dentists. And one of the feedback quotes that we have is, well, if anything, I'm glad for this information, although I am angry, at least I know why. And I think that sums up the public frustration with dental services. Some of the other things that our volunteers have done, obviously, they, apart from attending meetings, they actually support staff with projects, with drafting reports, and representing us at all kinds of events and meetings. They help keep us up to date with local information. A lot of our volunteers are part of other groups, so they help people to have their say and bring in up-to-date information for us of what's going on the ground. They helped us achieve investing in volunteers re-accreditation. That was quite a big task as well for us as a small organisation to accomplish. At random group of volunteers are interviewed for this, and all our policies and procedures have gone through, but at least we got it again, which was very good. Young Healthwatch Northamptonshire, our volunteers there do an absolutely amazing job, and our Young Healthwatch supported the Youth Advisory Board for the Children's Transformation Programme as well. A little bit more about Young Healthwatch. They do an amazing job. They all live in Northamptonshire, 11 to 24-year-olds, although at times we have had younger ones there. They all want to make a difference locally, and they really do help us get the views from other young people. Some of the words from our young volunteers, I will read them out because I know some people that are attending are sight impaired, so will not be able to see the slides. So Layla said, I've been given so many opportunities that wouldn't have happened otherwise. It's a good way to get a bit of experience. Daryl said, I volunteer with Healthwatch to be educated on people who are in different positions to me. I also like to be able to help with issues concerning young people. And Anya, I've stood up in the meetings and presentations, and because I have a voice, it's built up confidence. So she's one of our volunteers that's been on the BBC breakfast show, and she's also worked with the Royal Society of Public Health. The main project they did, as I mentioned earlier, was improving young people's transition from youth to adult mental health services. So from CAMS to adult services. And the main findings were how they spoke about how they struggled with that transition. There was a decline in their mental and physical health. It exaggerated the stress for them of the process. They were left unsettled and confused. And led by Esther for the CCG, we did a series of very hard-hitting short films which gave their view, and as most young people are, they told it how it is. And I think CCG valued their openness, their honesty, and it will inform the mental health pathway for children and young people, and hopefully lead to more improvements. So thank you, Young Healthwatch. You do an amazing job as always. All the detail, as I mentioned earlier, can be found on our website and in the annual report. Looking forward to 2022-23, which is the current year that we're in. Volunteers set their priorities in February for the coming year, and these are some of the things, and I emphasize some of the things because there is a lot going on at the moment. So one of our main projects has been gathering the patient experience on access to GP appointments. That survey has now closed. That closed on the 30th of September, and we are now collating that information into a report that we will share with commissioners and providers. We've been heavily involved in the development of the integrated care system. That only went live on the 1st of July. So we've been working with the Integrated Care Board and the Integrated Care Partnership. We sit on the Integrated Care Partnership Strategy Board, which is developing the overall strategy for partners working together across Northamptonshire and working with what they are hoping will be the 10 top level outcomes that they want to work on over the next 2 years for the public. We now have 2 health and wellbeing boards instead of 1 that we had before. Sheila sits on the North Health and Wellbeing Board for us, and Wendy sits on the West Health and Wellbeing Board. And we also have North Place and West Place, and there's several boards that are both in North and West that we now have to cover with our volunteers. So that's why I was saying we can never do all the work without them. Impact of COVID-19 on people and the resumption of services. We haven't done any particular work on this, although we continue to take public feedback on what the issues are. Young Healthwatch project in East Northants, that has now closed, and we are working on the report for that. Our watching brief on dentistry continues. Chris Drage represents us on regional working groups. The advisory board recently wrote out to all our local MPs, and via the MPs we have had responses back from NHS England. We also have a meeting next week with the MP Chris Heaton Harris to highlight what our issues are, and that will be attended by Chris Drage and Marcia. We have attempted to resume interim view. We were working with the Maternity Voices Partnership to do some maternity visits at Northampton General and Kettering General. They had to be postponed. We have since reorganised those, and we're hoping to do those within the next few weeks. We have lined up a visit to Corby Urgent Care Centre as well, so we're hoping to visit that on 3 or 4 different sessions over a week with our volunteers. We had just set up resuming interim view at Kettering General. We got everything in place one day, and then the next day we were advised that everything would need to be put on hold again because the rising COVID rates in the hospital. And Sheila and Wendy will keep us informed of when we can resume that programme. Not least is our finances for that year. 195k does not go very far. So that was the amount that we received from the local authority to fund what is in effect now 2 Healthwatch, Healthwatch North Northamptonshire and Healthwatch West Northamptonshire. We also brought in additional funding of around 60k, which gave us a total of 255k for the year. So our staff costs, 172,000, sorry, start that again, 172,000, I'm losing my words now. And the operational costs were about 37,000, and support and admin was about 16, giving a total of 226,000. So the total expenditure exceeded the core local authority funding by £31,479.30. So you can see it was another year that we subsidised the core contract by doing additional work. And I think, Marcia, that is me for now. I will go back to the main screen if I can stop share, and we will take any questions
particularly
on that. Yeah, and I do have some questions as well that have been previously sent in, but if there's any questions from anyone attending, if you'd like to pop up your hands, we will let you have your say. No? Oh, well, we got off quite lightly there then, if there's no other questions.
Nobody's shouting at us that we can't see.
So all the information is on our website and in the annual report, and all the reports with the impact in more detail is all on the websites too. So we have had 3 questions. They came in from David Tredia, who has a company called Healthwatch Northamptonshire Limited, which is nothing to do with connected together the community interest that holds the contract for Healthwatch North and Healthwatch West Northamptonshire. So I will read out the questions and then I will answer them. So question 1 was, how much has CIC HWN spent on legal expenses over multiple former members of the HWN between April 2001 and now? How much is anticipated to be spent on these issues for the remainder of the 22-23 financial year? And could there please be a frank written explanation as to why these expenses have occurred and how they are justified? What is the remaining HWN budget for this financial year, and what its projected headline events, please? So within With respect to question 1, David asked for information from the CIC, so we presume he means Connected Together Community Interest Company. But as this meeting is the annual meeting of Healthwatch, not Connected Together meeting, then we really can't answer on behalf of the KIC. So we have forwarded David Tradier's request to the KIC. I have already written a response to him. All our accounts are registered at Companies House. So if anybody wants to see our accounts for that year, they are on the Company House website. With question 2, again, it's not clear whether the information sought is in with respect to Healthwatch or to Connected Together, so hence we need further clarification there. We are able to say that Healthwatch at this point in time, any such expenditure we can't answer because of it is the KIC that is answerable for the finances. With respect to question 3, the remaining budget for Healthwatch for the second half of 22-23 is approximately half of the annual budget. So I've already gone through the annual budget earlier. The slides will be from this meeting will be on the website. The recording of this meeting will also be on YouTube. With regard to the headline events, I've already outlined the work plan that the volunteers have set for 22-23, and their work plan is also on the website, so you can review their vision, value and strategy, and work plan is all there. Any further questions for me? No. So I'll share screen again. Right, that's you.
Well, that was very, thank you very much, Kate, for that explanation. And I hope that it helps to explain to people the division between Healthwatch and the KIC. It's a clear division. I do believe David has also been sent replies in the same way. So he's been fortunate enough to receive replies ahead of the meeting. And we just hope if people had any further queries, they could raise them. So for me, this is now the favourite bit, because it's my bit to say a huge thank you. I've been given the opportunity to work with staff and volunteers in the absolute interest of the wider community, and I very much hope I know we are doing that. So to our volunteers, especially board members, who there's some fairly new ones, old ones that have come back, and new ones, a hugest thank you for your diligence and the way you sort of conduct yourselves and volunteer information. And to the planning group, that will include some of you, but other people, for the excellent reports that we receive that will inform the work that we're doing. It's really a big commitment, isn't it? It's a huge commitment from all of our volunteers. So the biggest thank you goes to the volunteers. Then we've got Young Healthwatch, and it's always good. You're always looking to see what creativeness they're going to come forward with. Not easy for them. They know the difficulties. They know how things are for that age group of 11 to 24, but they do tackle it, and we're looking forward to them coming up with new projects, although I dare say some of the previous projects are as new now as they were then. very much thank you to the staff, because sorry not having the volunteers out there working away and beavering, but we have got staff that enable the volunteers to really work and who express care to the volunteers, to the point where we've got volunteers working alongside the staff. And that's always a good thing to see that happening. That's when people are very comfortable with each other and they trust each other, and they feel that they can work together to achieve the success that Healthwatch needs in order to move things forward in the community. Things are not brilliant at the moment, we know. Hard times are ahead. Impact of health is already happening, but I am very confident as we try and just increase 1 or 2 members of staff, as we engage with other volunteers and other organizations, that it can only be a positive way forward, that we will move on for the benefit of the wider community that's out there in Northamptonshire and Rutland as well, because we see them as relatives, that we can work together. They can borrow us, and I know from time to time you feel you want to talk to them as well. So thank you everyone for attending this evening, and we look forward to seeing you in person next year. It's so important that we all meet up. Do keep an eye on the website, because we have board meetings and planning group meetings. Keep an eye to see when those are, and the end results minutes will be there to keep you informed as to what exactly we're doing. In February and March, the planning group will meet to look at the program ahead. So, you know, you can always go on there, or send into inquiries if you feel something is missing or you can't find something, and hopefully we can work together. Thank you.
Thank you, Marcy and Kate. Nice to see you all as well.
Thank you very much. Thank you.
Bye-bye, everyone.
Thank
Bye.
you. Bye-bye.
Thanks for attending.
Thanks for attending. Bye.